Welcome to Healthcare Today. Ligament injury, as we think is the injury of the sportsman, is not the true thing. It can happen in road traffic accidents also, especially the scenario in India where two-wheelers is most commonly used and frequently used, and any accidents involving the two-wheeler, they can contribute to the ligament injury. So when the ligament injury happens, it's not only the ligament injury, knee ligament injury, along with they can injure the meniscus and also damage the cartilage of the joint. In current development of healthcare system in India, in most of the centers, the facilities available for the ligament injury surgery. So these surgeries are being done nearly most of the hospitals. After ligament injury, most of the patients, they get well and they come back to the normal life, but some of the patients, they really remain symptomatic, and we found that the reason for being symptomatic is that the injury other than the ligament injury, like the cartilage injury, if they remains back and doesn't heal, they remains as a symptomatic patient, painful knee, and they cannot come back to the normal life. Why this ligament cartilage injury doesn't heal? So the treatment for the cartilage injury is not as straightforward as treating the ligament injury or the meniscal injury. It is different, and the technical specialties and support is not available in every centers. This is one reason. Sometimes the injury that remains at the time of the injury, initial injury, the amount of cartilage injury remains, they are not indicated for any active procedure at that time and expected that they will heal by their own. But unfortunately, some of the patient, it doesn't heal. Why they don't heal? Either the ligament reconstructions doesn't recover as expected, like their instability remains, or they have some inherent alignment issue in their limb, or they have some meniscal injury that is high grade and could not be repaired. All these factors can contribute to non-healing of the cartilage injury, and they can convert into chondromalacia of the cartilage, and they are painful, very much painful. Earlier, the treatment for this cartilage injury was very expensive and they are very sophisticated. That is to be, you need a very good lab support behind who can do cell culture. Without that, it is not possible. That means you have to take some cartilage from the patient's joint, send it to the lab for the culture, get the cartilage and stick that injured area in the second surgery, and it was very difficult because availability of the lab was not so easy. But now we have very easy things. We have a readily available bioactive chemicals in the market. We can use it to regrow the cartilage on the naked area or injured area. So all these patients who have post-traumatic chondromalacia, we can treat them effectively and very easily. Only what we have to do, we have to find out, is there any residual cause for non-healing of the cartilage injury, or the cartilage injury itself was huge enough and was not addressed at the initial treatment time. When we find out all those things, we can go a one-go surgery. We can apply that bioactive chemical on the rough area where the cartilage is not there and let it heal, and it will create a second layer of cartilage and make the patients pain free. And at the same time, if there is some other residual factors like instability, alignment issue, we have to address that thing also in the same patients, and they can be cured and pain free. We care for it.